everyone, and thank you all for coming out tonight to support me and all the other great Civic Fellows. My name is Voto, and I'm a senior here in Richmond. I have a Bachelor in Science in Biochemistry and Molecular Biology and a minor in Business Administration. I was born in New York City, but when I was 5, I moved to Manhasset, Long Island. I'm a pre-medical student who is currently in the middle of the application process, and I'm waiting to hear back from a number of schools. For as long as I can remember, I wanted to be a doctor. And I would be lying to you if I didn't say that as a child, I had dreams of becoming an emergency heart surgeon who only performed the most elaborate and dangerous procedures. But it was not until my sophomore year, the summer after my sophomore year, that my whole perspective on medicine changed. It was then when I traveled to Sicily, which is the home of my ancestors. As you can imagine, Sicily is very different from New York City, and that it's a very rural area. I noticed that there was a need for a stronger healthcare system, so then I immediately fell in love with rural medicine. At the start of last year, I set out to find an internship that met that interest, and that would hopefully give me a lot of working political experience. With the help of Cassie Price at the Office of Civic Engagement, Brennan Halligan at Career Services, George Hiller, professor at the B School, and my faculty mentor, I was able to find the Health Wagon. The Health Wagon is a small, nonprofit organization that provides free health services to the medically underserved of Southwest Virginia. The organization is based out of Wise, Virginia, a small coal mining town, and back in its heyday it was flourishing, but recently the coal mining industry has diminished, and unfortunately now it's a town that needs a little help. The Health Wagon also sees patients in the adjacent counties, Dickinson, Russell, Buchanan, Lee, and Scott counties, for example. For those of you who are unfamiliar with the area, Wise is 7 hours west of Richmond, and it's in the Appalachian Mountains, and it borders Kentucky and Tennessee. The poverty rate among the Health Wagon patients is 70 to 140% higher than the rest of Virginia. Unemployment rates are 5 times higher than the state average. And compared to the rest of Virginia, patients are 21% more likely to die from heart disease, 14% more likely to die from diabetes, 35% more likely to die from COPD, 40% more likely from work-related injuries, and 50% more likely from suicide. The Health Wagon was founded in 1980 by Sister Bernie Kenny from the Order of Medical Missionaries of Mary. Sister Bernie came to the Appalachian Mountains at the request of the Richmond Catholic Diocese, and she started the program by providing health care by traveling in her Volkswagen Beetle. In 2005, she handed down the reins to Teresa Gardner. Teresa Gardner grew up in the Southwest Virginia area, and she worked for the Health Wagon her entire career. Today, the Health Wagon is run by Dr. Gardner and her longtime best friend, Paula Mead. The organization continues to meet the unique challenges that patients face in these poverty-stricken areas. What is perhaps most interesting about the Health Wagon, that's the actual wagon. What's most interesting about it is that it is an innovative mobile health unit that actually brings the doctor's office to the patient. A lot of patients don't have access to transportation, so they would set up in parking lots and maybe near restaurants or a store, and people would just come in and they'd be seen. This is me in one of the rooms. The wagon mechanically stretches out when parked and has 2 rooms just like this, a nurse's station, a bathroom, and a small patient waiting area. And usually they send out 2 nurse practitioners and a nurse when they go out. Last year, the Health Wagon saw over 11,000 patients and provided $1 million in free services. Over $1 million. As an intern, I learned a lot about how to run both the clinical and business sides of a medical nonprofit. I experienced tasks that ranged from balancing budgets, advertising, and shadowing physicians for countless hours. I arrived in Wise on June 20th, about 5 weeks before the Wise Remote Area Medical Clinic, RAN for short. The Wise RAN Clinic is the largest free health expo in the United States. It sees over 2,000 patients in 3 days, and hundreds of doctors and patients travel from all over the country. During these 5 weeks, my work revolved around organizing the RAN plan. For me, this meant gathering donations and supplies, advertising around the local towns, and contacting medical specialists to see if they were willing to volunteer. My biggest project, however, was the patient recruitment for the first ever FAA-approved drone delivery of medication in the history of the United States. On the first day of this year's RAM event, an unmanned drone airdropped medication for 24 patients over the course of 4 separate deliveries in front of thousands of spectators. Among the spectators was Governor McAuliffe, Virginia Secretary of Treasury Karen Jackson, NASA representatives, and Tom Bass, the CEO of Flurry, which is a drone technology company based in New Zealand. My job for this event was to recruit 30 patients, schedule delivery times, find the medications through coordination with local pharmacies, and ensure that all patients arrived on time. This is me and Governor McAuliffe. During this event, I had the opportunity to work closely with NASA and Flurry, the drone company, as well as meet the governor. For the rest of the RAM event, I worked in medical triage with my mentor George Hiller, which is here, he's here today, and his wife, Miss Laura Hiller, who couldn't make it tonight. I was able to make connections with a number of physicians. I met a nephrologist from Norfolk, a plastic surgeon from North Carolina, and an orthopedist from Cincinnati. I was also able to meet one of my personal idols, Stan Brock, the creator of Remote Area Medical. I offered to pick him up from the airport when he arrived the night before. It was a great opportunity having a one-on-one discussion with him. He also flew in his own private airplane, which was really cool, and he's 80-something years old, which is amazing. I'd like to share a short video. It's about 3 minutes long about the health wagon staff and kind of the background of what went into the RAN clinic.
I got started with the health wagon when I had my first daughter action at the local Catholic hospital, St. Mary's Hospital. And Sister Bernie Kenny, she had an opening for the health wagon. At that time, I had never been in there. I had never heard of the health wagon. It was over in Dickinson County, Jackson County. So I went for an interview with Sister Bernie and just kind of how she talked about the mission and what she was involved in. I knew it was something that I...
How are you doing today? I just want to ask you a few questions. How did you get into nursing?
I wanted to be a veterinarian when I was growing up, and I did not do that. And I had a couple of family members with some illnesses, and I wanted to learn my abilities.
I've always wanted to be a nurse ever since I can remember. I was in kindergarten and drew my grandma picture. It was her laying on the bed when I said I was going to be a nurse so I could take care of her.
Yeah, ever since then.
Ever since then.
Patients, and for each one of you that come every year diligently, and we want you all to give yourself a hand, and thank you for coming next year again.
It's all got to start somewhere.
Remote Area Medical was started by Stan Brock, a British philanthropist who was most famous for his early work as a cowboy in British Guiana. He went on to co-host the television series Wild Kingdom and star in several films. In 1985, Stan sold everything he had earned from television and started RAN. Stan instantly transformed from cowboy to medicine man. RAN has come to Wise for the last 15 years. This year, the event took place from July 19th through 21st, and it saw approximately 2,400 patients for all of dental, medical, and vision.
We get patients who have not received medical care probably in years. A lot of those are diabetics and they don't know it. They say they feel bad. They come in and that's the first thing we find. They don't take any kind of medications, they're hypertensive. They're usually trying to...
Do you have any memorable RAN stories?
I think every run, we have, very memorable moments. I mean, especially when those lives are saved, just like the past rain event that we just had. There was a lady that presented, I think, with some pelvic pain, and she had an ectopic pregnancy and a uterine pregnancy with fetal demise. And, stories like that, she was sent out to the emergency room. Our goal for healthcare is certainly one where we would see, mortality and morbidity rates decline. And I think we've had to have, after 16 years of doing events, I think we've had to have some difference in that, and, in a positive manner. And so it's always, revolves around, I think, giving people more, sustainable and enjoy life and improve the quality of life.
I also have a full documentary that I made while I was there, and that can be found on YouTube if any of you want to see the full video. That's just short clips. In conclusion, I just want to mention that moving to Southwest Virginia, coming from New York City, was definitely quite a culture shock. I met people that are so different from me, but they ended up becoming some of my greatest friends. I think it was one of the best experiences I've ever had, and if I could do it again, I definitely would. And I definitely see it as a future career path for me. And before this summer, I would not have thought that. And I just want to thank everyone who made this possible, especially the health wagon staff, specifically Teresa Gardner, Paul Mead, David Mead, Haley Cantrell, Anna Baker, and Crystal Clark. My fellowship mentor, Professor George Hiller, University of Richmond Civic Fellowship Program, Ms. Cassie Price, Ms. Heather Ashton, and Dr. and Mrs. Burns. Thank you so much.